What's mental, guys? My name is Alvin Maina, and welcome back to my YouTube channel. If you're new here, kindly remember to subscribe. Click that subscribe button down there below and support my channel. Thank you guys for continuing to support my channel by watching every video, or liking the video, commenting down below, and sharing the video. Now, last week, or rather the other week, I introduced a new segment whereby I'll be shouting out a new subscriber who comments down on my YouTube videos, and wait till the end of the video so that you can find out who was this week's new subscriber. So for today's topic about mental health, we are going to be talking about substance abuse disorders. Now, a substance abuse disorder, or rather a substance use disorder, in abbreviation is usually SUD, is a mental disorder that affects a person's brains and behavior, leading to a person's inability to control their use of substances, either legal or illegal, drugs, alcohol, or medications. Now, there are various types of substance use disorders, and now the diagnosis for this is usually carried out based on the primary substance that a patient usually misuses, and the following types are as illustrated down below. I'm going to do just a few because of time. I'm going to do only 3, but this information can also be found out on the internet. You can go and find out more on the various substance use disorders. Now, for the first one, I'm going to start off with opioid use disorders. Now, opioid are a class of drugs that include heroin and prescribed pain relievers. Now, for this one, repeated opioid use changes the normal functioning of the brain, creating a long-lasting imbalances in brain circuits and hormonal systems that are usually not easily reversible. Now, this can affect one's decision-making abilities and regulating their behaviors, and also there are certain responses to stressful situations. The second one that I'm going to do is going to be on marijuana use disorders. Now, marijuana is also known as weed or pot or whichever name you want to say. Just don't say wajakoya here. We don't do that. So for marijuana, it can either be smoked or even vaporized, for those who use vape. Also, it can be eaten, and in other instances, it can be brewed in tea. Now, the short-term effects for using marijuana include, but are not limited to, altered senses, like you can be seeing brighter colors. Then there is also the change in one's mood. Your mood is always fluctuating. At one point it's high, at another point it's low. You can also have impaired memory, and also one can get increased heart rate, among other symptoms. The long-term marijuana consumption effects has been linked to mental health illnesses in some users, such as worsening symptoms in patients that usually experience bipolar disorders. The second effect can be in increased rates of depression and social anxiety disorders. Now, just for emphasis, or rather a note better, you need to know that regular use of marijuana among adolescents, or rather by adolescents, increases one's chances of having impaired brain development, and this can have a long-term impact on learning and one's memory. You know, adolescents, they are usually in school and they need to learn, and they need a good memory so that they can be able to store the knowledge that the teachers are passing on to them, so that they can also be able to apply this knowledge in their day-to-day life, or rather be able to use this knowledge to pass exams and maybe other reasons. The third type of substance use disorder that I'm going to talk about is going to be alcohol use disorder. Now, for this one, the alcohol use disorder is also known as AUD. That's in abbreviation form. Now, when one has trouble controlling their drinking despite the negative effect it has on their well-being, or rather their health, even relationships, may may it be with your family, maybe even with your friends or other related people, they may get to experience AUD, which is alcohol use disorder. Now, this can also be linked to as, or rather be termed to as addiction. Now, for severe AUD, or rather addiction, severe alcohol use disorder, or rather addiction, is a chronic brain relapsing brain disease characterized by compulsive alcohol use, whereby you cannot control the amount of alcohol that you are intaking into your body. If you just find alcohol, you'll be consuming it, at a, or rather in large amounts. Now, heavy drinking can damage the drinkers, or rather the person that is experiencing the alcohol use disorder. It can it can affect their heart, the liver, the pancreas, and even weaken the immune system. And also, it can increase a person's risk to developing certain types of cancers. The best treatment for alcohol use disorders usually involves the combination of medications and behavioral counseling, whereby, let's say, if you go maybe to hospital, or rather therapy, or even rehabs, your doctors can use a combination of medications to help you overcome your addiction on alcohol, and they can also counsel you on your behaviors. Like, they can try to find out what are the triggers that usually lead you to maybe using these substances, and they can be able to help you. Now, the overall treatment plan for drug drug use disorders, or rather drug abuse disorders, includes, like I've said earlier, taking medication and also getting behavioral counseling. Like, your doctors can help you overcome use these abuse disorders through medication. Then, for behavioral counseling, they can try to find out what triggers you to use these drugs. Maybe you just started out maybe using them slowly by slowly, and then you got addicted to them. They can help you overcome and start your journey to recovery, maybe by, helping you to reduce the amount of the drugs that you used to take, and also enable you to find other alternatives to keep yourself occupied, so that you cannot be led back to using these drugs. So if you are experiencing any kind of substance abuse disorders, kindly reach out, because help is always there. And remember, you're always not alone. You can always find help. Go to the nearest hospital or even rehab. They will give you the best kind of medication, and even counseling. They can be able to help you control your triggers, because the best way to fight these kind of things and overcome them is not by running away from your triggers. Because, okay, let me explain what a trigger is. A trigger can be something that leads you to use these drugs. Let's say, maybe if you feel like like you're depressed, or even lonely, or even you're having issues maybe in a relationship or another situation, maybe somebody close to you, something has happened to them. This all of this can be triggers that can lead you to use these drugs, or substances. And once you start consuming these drugs, you might start at from a low point. Maybe you can start, maybe if it's for alcohol, maybe you can start maybe with one beer, then you gradually continue advancing maybe to 2 beers in a day, maybe 3 beers in a day, 4 beers. You keep advancing to a larger amount than the one you started with. Now, all of this, as you continue advancing, it means that you're subjecting your body, or rather conditioning your body, to the fact that they need these drugs to function. And when you stop using these drugs, or you say, let me today not consume these drugs, and yet you've been doing it maybe for months, you're going to start experiencing withdrawal symptoms. Now, for you to be able to overcome the withdrawal symptoms, it means that you have to take these drugs so that your body cannot experience the withdrawal symptoms. And by consuming the drugs again, you're still continuing to become an addict. So that's why I'm advising anybody that is experiencing any problem related to substance or other drug abuse disorders, kindly reach out for help. Your doctors will be able to help you, give you the best type of medication and counseling to get you through, because everybody has a different kind of treatment plan, because it is usually tailored according to one's according to the type of drug that somebody was misusing. So once you are able to get through your triggers, it means that even when you come out of your medication, even rehab or rather hospital, even if you experience that kind of trigger again in your life, you can still be able to, face the trigger without relying on the substance abuse or rather drug abuse to get you through it. So that's going to be all for this week's episode. Now, for this week's episode, the new subscriber was Grace Karanja. Thank you so much for watching my video, for liking my video, and for sharing my video, and also for subscribing to my channel. Now, if you want to be next week's subscriber of the week, kindly subscribe to my channel and comment down when you're done, and also like the video and also share it with your friends. So without any other thing to do on the channel, I'll be seeing you guys next week. Peace out.